further in the topic of testing your eyes, what scans and tests are performed at an ophthalmologist for keratoconus?
Okay, so when we test, so I want to approach it a little bit differently. I would like to say, when we do laser vision correction, what type of test do we do to actually determine whether a patient is a candidate? In other words, that the patient does not have keratoconus. And the mainstay is a corneal scan, or a scan of that clear cornea, or the clear window in front of the eye. It is called corneal tomography. So tomography is where we look at the front and the back surface of this cornea, and normally you'll see a display on the doctor's computer screen. There will be like 4 maps, and the one will look at how steep the cornea is. Then there's a next little image, how thick the cornea is, are there any protrusions from the back, and the last one that we normally look at is all the various layers, especially the outer layer of the cornea. And in essence, if you see like a red hot spot on any of those scans, that normally points towards an abnormality or an elevation or a very steep area. It's normally at the bottom and towards the nose side. So if you look at that round little circle and you see at the bottom towards the side, there's a little red spot, especially on the little image that shows us elevation or protrusion from the back and the steepness of the cornea, then that normally points towards keratoconus. But there's also some algorithms that we then run through, because often it is not that obvious, especially if the keratoconus is of a low grade. And we're going to come and talk about the grading now. But if the keratoconus is very subtle, then we need special algorithms. We even employ AI, and it actually tells us what is the possibility, what is the chance of this patient having keratoconus. So there will never be a definite yes or no unless it's very pronounced. But often it will tell us, there's like an index, and will tell the likelihood of this person having keratoconus is quite high. And it's always important to err on the side of safety. And if we think that the patient might have keratoconus, we will not perform any laser intervention like for correction, and we'll rather follow the patient up.
And then